Good afternoon, namaskar, and welcome everyone to another edition of our webinars in the series Illness to Wellness. We have a very important topic that we are going to discuss with the galaxy of specialists from our country who are here, our esteemed panelists. And the topic is liver care, managing liver care rather. Liver is a very, very important organ in our body, which we understand very well and about which we're going to get lots of information from our esteemed panelists and specialists. But first, I would like to tell you a little about the program Illness to Wellness. This is a series of webinars which have started after the onset of COVID during the period of lockdown, in which ASSOCHAM, the CSR Council of ASSOCHAM, has been organizing these webinars for your benefit to get care directly to your home, to get you the best advice from one of the top specialists, not only from our country, but I would say one of the best specialists in the world on issues, on medical issues, on health issues, which are of concern to everyone in our country. And we have a very wide audience from across the country who watch these programs, ask their questions, and get answers to them. So I'm very thankful to all of you. First of all, our viewers for joining and being here. And I'm very thankful to our esteemed faculty who have joined us. And I would like to welcome you and thank you all once again on behalf of Sri Anil Rajputji, who is the chairperson SHM CSR Council. Unfortunately, he is not able to join today because of certain other engagements. Otherwise, he would have been welcoming you all in person. So I extend a warm welcome and my gratitude to all the esteemed faculty present here. Professor Dr. Shiv Kumar Sareen. He is Padma Bhushan. He is the head of Department of Hepatology and Director, Institute of Liver and Biliary Sciences. And Dr. Sakshi Karkra. She is head pediatric gastroenterology and hepatology, Artemis Hospital, Gurugram. Dr. Bhavin Bhupendra Pasawda. He is a surgical gastroenterologist, hepatobiliary and liver transplant surgeon at Shelby Multispecialty Hospital. And I'm here with you, Dr. Rajesh Kesri from Delhi, from Total Care Control. So once again, welcome everyone to another edition of Illness to Wellness webinar, Managing Liver Care. So let's start with you, Dr. Sakshi. Tell us about the important role of liver. Why is it that liver is such an important organ? Why is it that it has been mentioned since time immemorial? Because we read about liver in medical texts in ancient histories dating back to more than 2000 years, and it has been mentioned in Ayurveda. It has found so many different mentions in textbooks, in texts, and in literature. So what is, welcome, sir. I see uh, Dr. Sir has joined us. Dr. Sareen, welcome, sir. So, Dr. Sakshi, would you please start?
Yeah, good afternoon, everyone, and good afternoon, sir. We are all aware that you are absolutely right that liver is a very important organ. And actually, if we speak of the facts, it is like more than 500 functions in the body are actually being performed by liver, whether it is synthesis of important, all the whatever we are eating and it is getting assimilated, whether it's protein or carbohydrate getting stored as glycogen in liver, or taking care of cholesterol, or whether it is detoxification of the drugs we take or any harmful substances, the harmful ammonia which is being produced in the body being converted to urea and later on excreted by kidney. It is also a storage organ. It has immunomodulatory functions. So it controls clotting. So that's why we say that it's a very, very important organ, and it's not wrong when we keep saying ki jigar ka tukda, because Jigar is the most important thing in our body. So, well, yes, it take cares of almost all the organs directly or indirectly in the body, and it is managing. And most importantly, because being controlling the metabolism of various substances, producing proteins and carbohydrate, and taking care of cholesterol is something which is directly or indirectly affecting whole body as a whole. So I would say that yes, that's the most important thing. In addition to other different function, detoxification, excretion in the form of bile, and which helps in absorption of all the fat soluble things from the gut. So that is what is liver, and the way it has been placed in our body. Whatever blood is going through the gut, all the nutrition or food, whatever we are eating, it gets absorbed in the blood. Then, and first of all, it has to flow through liver, and then only whatever we are eating, it gets assimilated and is being utilized in a form where it can be actually utilized at different level in the body. So that's where the importance lies of liver.
Thank you so much, Dr. Sakshi. Thank you so much. Now I'd like to come to Professor Sareen sir. Sir, are you there?
Yes, very much. Yes, yes.
Welcome, sir. Welcome once again. Sir, uh, please throw some light about the role of liver in causing the modern day diseases. We are going through this epidemic of COVID, but there are unseen epidemics which are going on, and those are that of diabetes, obesity, and whatever other consequences of that. So please enlighten us. I think you do that extremely well, so that people are able to understand that. So
Thank you, Dr. Rajesh, and I enjoyed Dr. Sakshi's initial messages. Can you hear me well?
yes,
Yes,
sir, we
yes,
can hear
sir.
you very well.
So I'm in the car, so apologies. Uh, Liver is a organ which balances your intake and output. So all the energy in a manner of carbohydrate, fats, or proteins is finally to be converted into glucose, which is utilized for our energy production in two main organs. One is liver and second is muscle. If the muscle is unable to utilize that glucose, which is a result you are sitting all the day, you are not utilizing your muscles, that glucose is directed to the liver. And the liver, besides its own share of glucose, gets additional glucose, and this has to be converted for storing into fat. So the additional glucose now leads to formation of lipoproteins and fats, and you get the fatty liver. This, in addition to the fat you take, increases the fat content in the liver from more than 10%. Normally, the fat content in the liver is less than 5%, means of the total cells or the total volume or weight of the liver, 5% is fat. If it goes above 10%, it is fatty liver. Now, if a liver cell has fat, the insulin cannot get inside. If insulin cannot get inside, then more insulin is required to be made by pancreas. This is the basis of insulin resistance, and more insulin pancreas makes, it gets exhausted over time, and you start developing diabetes. First pre-diabetes where sugars are high, and then diabetes. So this process sometimes takes 5 to 10 years after fatty liver has developed. So if we can reduce the fat, excessive need of insulin will not be there. You can prevent, stop, delay development of diabetes. So the first lifestyle disease which is related to liver is diabetes, which in a way is a liver disease. Now the fat contained in the liver now goes into the blood, and you have high triglyceride, high cholesterol. You think, oh, from where has this cholesterol come? You go for a blood check, the triglyceride is 250, cholesterol is 280. All this is a spillover. I'm talking very crudely, a spillover from the liver. So what does it mean? If you have gone, your cholesterol is high, triglyceride is high, it is a fatty liver. Third, this fat which is now circulating is bound to get deposited into the arteries of, let's say, heart. You get hypertension, cardiac disease. If it goes into the brain, you get similarly stroke and many other chronic kidney disease. So the process starts from surplus energy to surplus diseases. If you can avoid this and do not make liver as a storehouse of fat and muscle as a utilizer, I think your lifestyle diseases will dramatically decrease. And therefore, we have to see not to burden liver. Another very common disease and misunderstood is a gallbladder stone. People think gallstone is a disease of gallbladder, but it is a disease of the liver. So this thick bile which contains extra cholesterol, all stones are generally cholesterol stones. So the bile with extra cholesterol gets into the gallbladder where it stays and gradually converts into a stone. So you see a person with gallbladder stone, you know what is happening. See a person with diabetes, blood pressure, or heart disease, you know where it has come. So the lifestyle diseases are actually misuse of muscle and overuse or disuse of liver, which can be corrected if simple understanding has developed.
Thank you. Thank you, sir. A question comes to my mind. Obviously, sir, whatever you're saying about the fat deposition in liver, that is the root cause of most of these diseases. But a question which would come naturally to my mind, I'm sure to many of the listeners and viewers also, fatty liver is very common these days. I think almost 70 to 80% of ultrasounds that we see, they have fatty liver to some extent or other. So, what are those extents? And would everyone with the fatty liver end up being a diabetic? Is it a warning sign? Should we consider it that way in that case, sir?
Very good question. Very good. So, fatty liver is in about 35% of the Indian population and it is increasing. And the main reason is the fructose that we take, uh, that is in the fruit juices or whatever, preservatives, the corn syrups. The people who are very likely to have fatty liver are overweight and obese, all diabetics. Now, those who are lean or normal weight, if they have any of the five metabolic syndrome criteria, means blood pressure or high cholesterol or low HDL, they are two of the five now are used for identifying normal weight. Earlier we were using obesity, blah blah for metabolic syndrome, but 2021 it has changed. Every diabetic has fatty liver by and large. Every obese or overweight has this, and the lean ones we use criteria. Your question, will every fatty liver lead to development of diabetes, is less likely. The reason is fatty liver itself is the first stage. If you have fatty liver plus high SGPT or ALT, so there is a Framingham study 2008. The children of third generation of Framingham study who were born and had high ALT, let's say 80, they developed diabetes 5 times more than their counterparts if ALT was 80 in a period of 10 years. So suppose you have fatty liver but normal ALT, you are still okay. there is fat, no inflammation. Therefore, in my mind, we need large studies, but remember that it is a predisposition, it is not development. Fatty liver is a much earlier stage. It makes susceptible, but not everybody. Second part is the role of genes. So today, guy with fatty liver may not develop diabetes, but his grandchildren will develop diabetes. This is very well. So there was a paper in Science. Live for your
If I could just
grandchildren.
request you to switch on the camera if it is not difficult. I'm
Uh,
sorry for interrupting.
you won't like the car travel and the way,
Okay.
but I
Okay. That's
will just for
doesn't
the
matter,
sake,
sir.
I will just
Yes. Thank you,
mention
sir.
it.
Thank you.
But
Please
what I'm
continue.
saying,
Please continue.
fatty liver will be able to may is likely to give you the risk in 2 generations from now. If fatty liver plus high ALT, you yourself will be susceptible, but only fatty liver 2 generations before this will manifest.
Thank you, sir. That has very far-reaching consequences, and I understand that you are in a hurry today. One more question to you, sir.
Yes,
When we
please.
talk about ALT and SGOT, SGPT levels, ALT and AST, we get different ranges because people also ask, they are also aware about these values. And I've heard from you that the ranges that we should be targeting are much less than what we see usually written in the report. So, what is your view about these?
Yeah, three very important things. And first is gamma GT, gamma glutyl transpeptidase. This enzyme is often forgotten. Gamma GT closely links with heart disease. So if somebody has high gamma GT, two things need to be asked. Are you drinking alcohol? Or if not, very high chance of having a heart disease or dyslipidemia. Two, if somebody has high SGOT, then SGPT, either he has fibrosis in the liver, that is a stiffness, or he is using certain drugs like indigenous herbal medicine, which is causing this injury. SGOT high should never occur. Three, if SGPT is high, our levels at ILBS are 19 and SGOT are, no, sorry, SG, for females it is 19, for males it is 30. These are the US standards. So if somebody has an SGPT of 40, his cardiac risk is still about 2 to 3 times higher, and liver related risk are 5 to 6 times higher. So I do not agree with an SGPT of 40 as normal. An SGPT of 25 to 30 should be considered as good value. These are large Korean studies which have shown. So my suggestion for a normal value is whatever is in India, consider half of that as normal. 40 is there, somewhere 45. Consider 20, 25 as normal. But remember, gamma GT is worse. And the important part of SGPT is a famous study called Hunch study from Scandinavia. If a 26-year-old man 26-year-old man has an SGPT of 80, the risk of his first heart attack at 36 is 7 times higher. So, a young man with SGPT high, it is a syndrome of severe inflammation. So, SGPT or ALT defines chronic inflammation in the body. The protein is produced by the liver but affects the whole body. So the carry home message is keep your SGPT at 20, body is not inflamed, and all comorbidities, whether it is COVID, whether it is drug induced injury, can be reduced to a very large extent.
Thank you. Thank you,
Thank
sir. Thank you so much. You have so nicely and so well explained in such simple language so many very important things which I'm sure everyone would understand and people would try to follow the importance of liver in the whole body, in the health of the body, and in prevention of diabetes and heart disease. Thank you so much, sir. Thank you so much.
Thank you. Thank you so much.
Uh, Thank you. Now I'd like to come to you, Dr. Bhavin. Since we've been having quite a lot of discussion now about the diagnosis part and about managing, the topic also is managing. So, what are the usual investigations? मतलब क्या टेस्ट जैसे ब्लड का लिवर तो हम टेस्ट सब कराते हैं, but are there any special tests which should also be done?
Uh, that depends on the
Which are
etiology.
not common, which are not very common.
Yeah, which are not very common. First, if we are dealing first, every investigation start with the history. So we need to see that the patient is having any liver problem since long or it is in the recent past. Because in OPD, we in discussing all the chronic cases, we always forget about the acute hepatitis or acute liver disease. So whenever a patient comes with altered LFT, if it is a recent history, then definitely we need to see that SGOT, SGPT would be very high. In India, we need to see hepatitis A as well as hepatitis A, which is actually more common than the hepatitis A. And it may not be a politically correct thing, but we need to ask drug history, particularly Ayurvedic, homeopathic, and any herbal drugs, because these are now accepted causes of liver failure, and that can be a very dangerous thing. In fact, in India, it is one of the most common causes for liver transplants also. Second, if patient is having, say, as Dr. Sarin has beautifully explained, that report of fatty liver of any or cirrhosis or any evidences of chronic liver disease, then apart from usual thing, we need to start again. We start from history, whether any alcoholic histories are there or not. If no alcoholic history, we generally order viral disease panel, which is a chronic viral disease. Most common are of course hepatitis B and hepatitis C. And another important thing, which Dr. Sarin also said, that we need to adjust our SGOT, SGPT level, generally in the less than 20 in females and more than less than 30 in males, which is also true for managing the hepatitis B and hepatitis C viral disease. First of all, if patient turns out to be hepatitis C positive, then every hepatitis C patient needs treatment. First hepatitis C antibody or is positive, then we order the hepatitis C RNA, which is the quantitative analysis of how many, in layman term, we can say how many hepatitis C virus are there, and it actually it is a first investigation to follow our treatment. Then there are fantastic oral drugs available. We can start the treatment and check with the hepatitis C viral load. Then of course, if hepatitis B is positive, we need to see whether that SGOT, SGPT is elevated or not, and it is according to the level mentioned by Dr. Sarin and not our normal laboratory values. If those are elevated, we order hepatitis B viral load also, and there are criteria when to start antivirals. And when we start antivirals, generally hepatitis B and hepatitis C can be treated. And in fact, in last 10 years, earlier it was hepatitis C and hepatitis B are the most common causes of end-stage liver disease, which has now decreased significantly. And even indication of transplants are falling down. And if we concentrate on managing them earlier, these patients may not need transplants also. Then there are rare genetic diseases like autoimmune diseases, primary biliary cirrhosis. There are specific tests for that, but I think that would be beyond the scope of normal discussions. So I think that's how, in some cases, we also require liver biopsies to finally know which kind of disease process is going on in the liver.
Sure, sure. I just wanted you to tell us, tell the patients about fibroscan, because this is one test we frequently prescribe now and patients frequently don't understand. Yes, please, please.
It's an interesting history of fibroscan, because
Yes.
we are transplant surgeons. So initially we condemned fibroscans like anything before 5-10 years. And
Yes.
in fact, we used to tell that fibroscans are useless investigation. Why to do that? But in the
Yes.
last 5 years, many fantastic evidences are coming that if we use fibroscan, is basically that gives you the grading of liver damage. Any liver disease goes to the 4 stages. Initially, it is always a fatty liver. Then the fibrosis starts. Fibrosis is where the damage of the liver starts. It is in the 4 stage: stage 1, stage 2, stage 3, and stage 4. Stage 4 and stage 5 are considered the cirrhosis. After that, the end stage and problem of liver disease starts. So if we can detect those stages of fibrosis early, after these fantastic treatments are available in life last 5 to 6 years, we can even reverse the process of liver damage. And initially we used to do biopsies for that, but now fibroscans, and there are specific levels of fibroscan reading for each diseases, and we can reverse the process. We can exactly know how to prognosticate that. So in last 5 years, I have changed my stance completely. From the opponent of fibroscan, I am now a very much promoter of the fibroscan. We can say that.
Thank you. Thank you so much. So I think if a doctor prescribes fibroscan, it should be done, and
Yes.
it is a very important modality.
Yes, but with the advice of doctors, I am against that. Many
Obviously.
health checkups now are including fibroscan. That should not be done.
Definitely, definitely. That is perfectly true. Dr. Sakshi, I would like to ask you a very, I would say, pertinent question because we are still going through the COVID pandemic, and now we are hearing about Delta Cron. So tell us about the role of liver in building immunity. How does it figure in our COVID scenario?
See, liver is a primary, you can say it's an organ through which each and every bacteria, whatever, because gut, whatever we are eating or drinking has to go through drug, getting absorbed from the circulation, and it has to pass through liver. So basically, liver has two type of things. It is, I would say it is more of an immunomodulator, modulating function rather than, producing antibodies or anything. So it is not producing antibodies per se, but yes, there are like two type of immunities which are there in the body. One is T cell type and one is B cell type. So the T cell type is specifically being modulated in the liver, and whatever bacteria, viruses or fungus or anything which is immunogenic, when it passes through liver, it activates the different cells present in the liver, and most of the time it is the helper type of cells which help in releasing specific substances which we call cytokines, and these are the things which usually activate other parts of the immune system once they are released by these specific cells. And so in COVID scenario per se, I would just say, because there have been papers, even we have seen, because I am basically dealing only with pediatric patients. So we have seen a child of COVID in liver failure. And what we realized was that and when we did biopsy, there was all necrosis, there was severe inflammation. So what we realize that whatever all these viruses, they are just specific, they are just promoting so much immune response in the liver that sometimes it can be damaging for itself. So what is more important is that there has to be a balance which is there. And if this balance is disturbed, sometimes this immune response start damaging the liver itself. So this type of balance, there are many regulator cells in the liver which is balancing whether they have to activate the system or they have to suppress it, or they should, they will just finish on their own. So if this balance is disturbed, so most of the time bacteria or viruses, they are finished by the immune response in liver only, but sometimes it is, if this balance is disturbed, and then at that point of time it start, damaging the liver itself. So I would say it's more of an immunomodulation which is having which is the function of liver, rather than only producing antibodies or specifically against any one kind of bacteria or virus. That is what is the more important function of liver. So I don't know, in simple terms, how do we say, it is just trying to balance, that's it. I mean, it is not a primary organ to promote immunity, but it is definitely producing specific substances so that it can stimulate other parts in the body which are actually concerned with the immunity. So that is,
Thank you.
yeah.
Thank you. Thank you, ma'am. Thank you for that. Dr. Bhavin, now please elaborate on the role of, because there's so many deficiencies these days of vitamin deficiencies. What role does liver have to play in formation of vitamins? Are there any special vitamins which pass through the liver, which are made by the liver?
See, there are many vitamins in the sense that we divide vitamins into generally fat solubles and non-fat soluble. We always say essentials and non-essential vitamins. So, in crude term, I would say most of the non-essential vitamins ultimately are produced by liver, and that is why in liver deficiency, initially it was believed that vitamin K is deficient, and that's why we used to correct INR. Of course, nowadays the entire belief has been changed. Liver plays important part in metabolism of vitamin B, both because vitamin B is a wide range of vitamins. Some are essential, some are not. Some are not essential. But yes, it plays a very important role in formation as well as metabolism. You can say almost all the vitamins.
Yes. And not only vitamins, I think liver plays a very important role in the six hormones also. So have you ever noticed that people with liver problems have some sexual or associated problems or
Yes, I
infertility?
think that's why one of the stigmata of chronic liver disease is deficiency of testosterone, testicular problems, and all this. So, in other words, liver is the production house of the body. There is
That's
nothing
true.
is not through liver, and that is why it is also known as factory of the liver. So you cannot run an economy without factory or productions.
Very true. I think that is very aptly said, that it is the factory of the body. Now, if there's something wrong in the factory, man, how do we realize that something has gone wrong? Because the body is still working. So tell us about this symptomatology. How can one suspect that? Because people have this problem. कहीं भी पेट में दर्द आ रहा है, मुझे liver की problem है, because I, being a physician and a diabetologist, I get so many patients who come to me even just with constipation, and they will already have done a blood test, a liver test, because मुझे तो liver में दर्द हो रहा है, liver में problem है. So could you
Liver
please
की
elaborate?
सूजन,
Maybe both
liver
of you
की
can elaborate, because
liver की सूजन. Let me be more specific.
liver में सूजन है. So
See, I usually encounter pediatric patients, and
I
most of the
understand.
time, like I'll just come to NAFLD. Let's assume it is NAFLD. Most of the time, it is detected. For some other reason, you are doing ultrasound and you find fatty liver. So what I mean to say is that it is mostly asymptomatic fatty liver in a child. In adults, maybe you can have some vague symptoms of anorexia, fatigue, not feeling well, low mood, all these vague symptoms. And and this is about fatty liver. Once it is, it is progressing, there is fibrosis, or the patient has reached to, cirrhotic stage, or if there is NASH, the patient can start experiencing pain, abdomen, or maybe mild jaundice, or other symptoms which are specific of end-stage liver disease. As far as other causes are concerned, like if it is infection, so acute hepatitis, we all know, will have jaundice, the patient will have fever, vomiting, pain, abdomen, everything. But again, chronic hepatitis is in kids. I am specifically speaking of children. They are actually picked up because if they have to undergo a surgery and they turn out to be positive for hepatitis B, and then we start evaluating, and then we find, okay, enzymes are also deranged and liver biopsy is also showing changes. So they will not have specific symptoms of chronic hepatitis B or hepatitis C infections. So they are picked up, but it is not same. Maybe Dr. Bhavin can tell about adults. For adults, definitely they present with manifestations. And very important thing is in kids, there is a very important group of patients which is having liver disease, that is metabolic liver disease. And that is something I would always want that they should never be missed, because they are treatable actually, because it's very painful to see a child who was missed, like a child with Wilson disease, and it was missed, and they come to us in liver failure and ultimately requiring a transplant, something which could have been picked earlier and could have been treated, and this could have been prevented. Okay, so these metabolic group is something which is usually missed, and they have to be picked up. And for them, the thing is, it is not always liver related signs in these metabolic group of patients. They will have other symptoms, so they are like indirect markers. For example, if there is hereditary fructose intolerance, what we say in a child, the child will only vomit. They will have aversion to sweets. They just don't want to have anything sweet. They'll start vomiting as soon as, and most of the time they are just being treated as gastroenteritis and vomiting and with PPIs and antacids and all, but nobody thinks that what is actually happening with the child. So that's an indirect hint that it could actually be a liver disease. Similarly, for Wilson, it can be initially just bad handwriting, or the child has started, the things have started falling from the hand, or there is red urine, there is hemolysis. That means unexplained hemolysis. So these are some indirect hints. So any child, what we say, if any child is having, say, recurrent gallstones without any, we are not aware, or if there is thrombocytopenia, which we cannot explain, or dark urine, or there are like slurring of speech, or vague neurological signs which we cannot explain, or vomitings, or fainting attacks, or seizure because of hypoglycemia, they should always be explored for any underlying metabolic liver disease. That's what I want to stress. For adults, I'll just tell Dr. Bhavin to give his experience here.
Yes, Dr. Bhavin.
Liver is a great regenerative power. I would say it is both blessings and disguise also. Because the liver can withstand many severe injury without any damage or without any apparent symptomatology, and that is also why liver disease are diagnosed in very late stage. So if we go for typical symptoms in a chronic liver disease in adult, what will be there? There will be jaundice or ascites or varicose bleed, or say encephalopathy, which is the mental disorder, lack of consciousness. So we are already looking at a decompensated liver disease. And at that stage, only curative treatment would be transplants. And in India, to say patient needs transplant is very easy, but to make patient reach to the transplant, to transplant him and also send him home is altogether a different process. So yes, liver is a great organ, it can regenerate on its own, but that is also a problem sometimes, because these all symptoms are basic symptoms are started only when liver is in the end state disease or cirrhosis. Before that, yes, LFT, initially small changes in SGOT, SGPT would be there. But as Dr. Shakshi also said, we also get patients when LFT is done for the part of some health checkups, or LFT has been done for pre-operative things, or viral markers or something like that. And those patients are usually fine. Even cirrhotic patients, that is the entire category we all know is the compensated cirrhosis. In compensated cirrhosis, patient does not have any symptoms, and you don't need to treat all those patients also, but you need to be more vigilant. And another major problem is whenever cirrhosis develops, sometimes patient directly come with what we forget to discuss is the liver cancer or hepatocellular carcinoma, and many a time it is already beyond all the treatment protocol. And that is why, along with the symptomology, I want to stress on that once you are diagnosed with cirrhosis, even if it is compensated, you are living your healthy life, every 6 monthly screening for liver cancer becomes very necessary. You need to just do a simple LFT, sonography, and AFP levels. You don't need those hi-fi tests of CTs or anything. But following up a cirrhotic patient becomes very important, because whenever we start talking of symptoms, it is already very late.
Very true. So in liver disease, we should not be looking at symptoms, because symptoms बहुत देर से आते हैं. जब आपको तकलीफ महसूस होती है लिवर की वजह से, तब देर हो चुकी होती है. तो इसीलिए बीच बीच में लिवर की जांच कराना जरूरी. So any idea how frequently people should be doing a liver test, and more than that, who should be doing a liver as a doctor, just for the purpose of prevention? आप किसको adult को आप prescribe करेंगे, हाँ भाई आप इतने time में जरूर कराया करो?
So I think if people have understand what Dr. Sarin told, answer lies there only. That
Yes.
First of all, you should be very active, healthy lifestyle, the lifestyle which is required for preventing of heart disease. lifestyle which is required for preventing of diabetes, same lifestyle applies to liver also. Because Dr. Sarin has explained very well that everything starts from the liver. So if you are, I would not say a 26-year-old otherwise healthy man should undergo LFT frequently or should undergo sonography frequently. In fact, sonography as a part of health checkups are generally not recommended and not evidence based. So any patient who is having any features of metabolic syndrome, say diabetes is there, any patient who is obese by means say his BMI is more than 30, any patient with heart disease should at least undergo LFT once a year if he does not, if he is not pre-diagnosed with liver disease. If he is pre-diagnosed with liver disease, then I would recommend LFT, USG, and one alpha fetoprotein to pick up that liver cancer at least every 6 monthly should be done. And those are the basic over-the-counter tests. You can even walk into any certified lab or any radiologic centers and get it done and show it to your physician, and if any problem is there, from there physician will take care of it.
Thank you. Thank you. So, Dr. Sakshi, what is the role of vaccines in preventing disease of liver? What diseases can be prevented? कब देनी है कुछ बताएंगे?
See, for as far as liver is concerned, we have only two vaccines till date for to prevent liver disease. One is hepatitis A and hepatitis B. And I would advise, I mean, this is given nowadays, it's there in our national immunization schedule. So most of the kids are already vaccinated. So for all these, but there is still a population, especially adult population, who have missed these. So I would suggest if any patient who is adult patient who has been diagnosed with fatty liver or any other chronic illness, they should make sure that their antibody levels for hepatitis B is adequate. And if not, they should be given a course of hepatitis B vaccine and hepatitis A vaccine also, because see, we don't want any patient to be having acute on chronic liver failure. You know, they already have an underlying liver disease. And if they get acute hepatitis A infection, which is very common in India, which can easily anybody can get from eating golgappas on street or eating outside, or even in eating in a marriage. We don't know how the hygiene is. So it's a very common infection in India. So any patient who has already a liver which is weak, any such infection is going to actually knock down the patient straight away. So as far as liver is concerned, these are the two protective vaccines available as of now. For hepatitis C, the things are still in process, but there is nothing as of now. So hepatitis A and B vaccines should be taken. So that's what is available as of. And for newborns, like a mother who is hepatitis B positive and she has delivered a baby, so they have absolutely different protocols, because some of them would require even immunoglobulin in addition to the vaccine, which is given immediately within 24 hours of birth. So they have set protocols which are there. So this should not be ignored. It should not be taken lightly. If anybody is positive, we have to be sure that, or anybody is having any liver disease. Sometimes what happens, like even we get kids who have already been vaccinated with hepatitis B and they come to us with other liver problems. And when we check their antibody levels, they are zero. So it's not necessary that you have taken vaccine and your body has actually taken that vaccine. It has, the antibodies are adequately formed.
Responded to them.
Yeah. So in these patients, if antibody levels, like the cutoff what we use for our patient is 10. So if it is less than 10, we definitely give a repeat course of dose schedule for hepatitis B vaccine. So that is it.
Thank you, ma'am. Now I just request you to shortly explain some things which I'm sure many of would be interesting for our viewers. Like, what is capsule endoscopy? I was reading your profile that you specialize in that.
So capsule endoscopy, what we do is there is one is upper gastrointestinal endoscopy, in which we put an endoscope through mouth and we can actually reach up to second part of duodenum, or for easier to understand, only the upper part of intestine. Okay. And by colonoscopy, we enter from anus and we can see whole of the large bowel and we can reach up to the last part of the small intestine. So there is a portion of intestine which is black box. We call it black box for as a layman thing. which cannot be seen by endoscopies from both up and down. So this is the portion for which capsule endoscopy is actually indicated, because we cannot directly see. Nowadays, we can even do enteroscopy, in which you can go beyond second or third part of duodenum and go a bit forward, but still there will be area which will be missed. So in capsule endoscopy, what they do is there is a specific capsule, and there is a machine which is, it's a belt which is, picking up the signal. So this capsule has a kind of which is taking images. It is ingested by adults, and for a child we usually place it inside, because the size of capsule is around 2.5 centimeter, so a child won't ingest it. So they ingest it, and then we just follow, the patient is followed up, and there is a battery, or I can say a sensor which is lying on the abdomen, which is tied over with the wires, and it is storing all the images which that capsule is taking when it is traversing through the small intestine of the patient. And ultimately the patient will pass it out in colon. And later on, we are actually seeing all these images in the computer. We connect that after maybe 12 hours, we'll remove the system, we'll put it on the computer, and we analyze all the images, whatever, and we can actually pick up if there is any lesion in the portion of intestine which could not be seen by upper and lower GI endoscopy. So basically, it's more of a diagnostic value. You can't do any therapeutic procedure with it. But sometimes we do get patients who have bleeding and we don't know where they are bleeding from. So we need to find out a focus. Okay, this is the place it is bleeding. And then it can be of help to the surgeons also. We can exactly tell the location and what type of lesion it is.
Thank you. Thank you. I think this must have been very interesting for our viewers, because there's very, very little talk about capsule endoscopy in general net. So thank you so much, ma'am. Thank you. Now I'd like to ask Dr. Bhavin first, you and you also, ma'am, about liver tonics. We've touched upon this topic. Dr. Sareen sir has also said about that. But it is a very, very common practice. The majority of the patients, they go to doctors also, and they're prescribed so many liver tonics which are Ayurvedic, and somehow it is in our psyche that पेट में problem है तो liver tonic ले लो ठीक हो जाएगा. We as doctors understand that they might be doing more harm. So please elaborate, both of you, about this. क्या हो सकता है?
See, I always tell, I always tell my patient that Live 52 has benefited only one person, that is Himalaya company. From our childhood also, we all must have taken that liters and liters of Live 52, and Himalaya is a public limited company, but no, it does not benefit. And some tonic, particularly prescribed in Ayurvedic and homeopathic thing. Now, the problem with our system is when we talk about the alternate medicine thing, it becomes a very political issue. But I think we should be a straightforward. The problem is that in what we call it, we all practice the evidence-based medicine. First of all, I disagree there is anything called homeopathy or allopathy as Ayurvedic. We all know penicillin comes from the plants. So I may be making some controversial statement, but thing is that every drug, be it allopathic, so-called allopathic, Ayurvedic or homeopathic, should undergo the vigorous clinical trial to assess the safety of this medication. In some of the tonics that we use, these trials are not there, and so actually we don't know how harmful they are. And we are sure that, see, liver is as I told you, liver is a great regenerative capacity. So most of the liver disease, we talk about all these serious liver disease, but we talk about the hardly 5 to 10% of the patients. When we look at the population of India, that 10% becomes a major chunk. But 80 to 90% patients who develop some kind of a liver infections, or say most common is hepatitis A or hepatitis E, are going to get all right on their own. So what happens that whenever we take tonics and after that we start improving, we almost correlate these things with that tonic. And in scientific studies, there is a common dictum, we call it the correlation is never a causation. And I am a Gujarati, so there is a saying in Gujarati, we call it Kagnu Besu and Dalnu Padu. That is, whenever if some crow sit on some branch of the tree and that branch falls down, that doesn't mean the crow is the super powerful he-man, that due to that branch has fallen. So I am against any liver tonic. Give your liver some time. And another thing, in acute hepatitis, many times we come across the patient who has stopped eating everything. They are on liters of sugarcane juices, and they continue doing so. So whenever there are liver diseases, petrol ke bina gaadi nahi chalti. You require nutrition, and nutrition is the one of the key factor for treatment of liver disease. So never stay away from food. You can have all the normal food which you can take. In fact, in liver disease, you require more protein. That's another myth, that protein should not be taken. So no liver tonic, yes to normal food and normal lifestyle. Be as active as possible, and you should be out of the liver disease most of the time.
Thank you. Ma'am, what has been your experience about people, especially children, because you deal more in children, using these such agents?
See, I will say, I mean, there have been many research, if we go by evidence based, I mean, there have been 2-3 herbal preparations which have been proven scientifically of being of some help, but I would not say like they are recommended, like silymarin is being used, and even live 52, many researches have been done, but this argument is always there. But as far as pediatric patients are concerned, because we cannot quantify the medication doses in these syrups, in these medications, we always say no for that. I am not sure about adults, but actually, yes, before this talk, actually, I went through all these papers for different, because we are not prescribing for kids, I was not aware, but I wanted to go about it. So there have been a big discussion about it, many papers and many, but yes, few preparations have been, now they have shown to be beneficial, especially silymarin. Not that but I am absolutely against some, तो बच्चों को जो वो चूरन पीस के दे देते हैं और कुछ पत्ते पीस के कुछ दे देते हैं from and not even knowing what they are giving, how much they are giving, that is absolutely a big no. And we have actually seen patients in liver failure because of these preparations, and with all aplastic anemia, with affecting almost multiple organs. So this is the reason. I'm not saying that Ayurvedic is a big no, but only problem with these medications and these things in pediatric age group is the quantification of doses and exactly what is there in that. And in addition to that, what else is there? We don't know whether it has been cleaned of the other things which might be actually harmful. The primary agent, what they are testing, probably is helping them. But the other contaminants, we are not sure whether they have been removed or not. So that is the biggest problem with these preparations. So for children, we do not prescribe. And I always tell my patients, please, I don't want a cocktail of medications. In case you have so much trust on that, you continue with that only, but don't create problem for us. We won't understand actually what's happening with the kids. So there is, yes, we do get a subset of patients which we call drug-induced liver injury, and it's a big subset which we get, and we don't know, and ultimately they go in a category of cryptogenic liver disease. When they will not give history, and later on when we keep, just rubbing them, they will tell, okay, हाँ ये भी दिया था, एक दिन हमने वो कुछ, एक बाबा जी ने वो भी दिया था चूरन. So this is what is all herbal medications, and we don't, promote these things at all.
डेफिनेटली. तो आप सबसे निवेदन है कि दवाई तभी लें जब आपको डॉक्टर ने, लिवर एक ऐसी चीज नहीं है कि आप कोई चूरन पाउडर खा लें और कोई सिरप ले लें तो सब बीमारियां ठीक हो जाएं, बिकॉज दे कैन बी डिफरेंट डिजीजेस. लिवर की जैसे हमने अभी तक बात की, दे कैन बी प्रॉब्लम, दे कैन बी एक्सेस ऑफ फैट, दे कैन बी वायरल इन्फेक्शंस, दे ऑल अफेक्ट द लिवर, एंड the symptoms may be similar, but the cause is different and the treatment is different. And the important thing is, many of the disease of liver are treatable, as both of you have mentioned, that if you pick them up in time, they are treatable and they would not lead to liver failure. So now let's come to prevention part. How can the disease of liver be prevented? Dr. Bhavin, we'll start with you. About the diet, What things would you recommend people to have, especially adults in your case, and what would you suggest them to stay away from to
Uh,
keep the liver healthy?
to keep the liver healthy, of course, now I think the healthy diet has been properly defined. The healthy diet means balanced diet. You need to take adequate amount of protein, adequate amount of carbohydrate, not too much carbohydrate, because I am coming from the Gujarat, and Gujarat loves carbohydrate. We don't have any protein content in our meal. We only live on carbohydrate. So avoid too much of carbohydrate. Take uh, reasonable quantity of carbohydrates. It's two rotis or two chapatis should be fine. uh, Take good amount of protein in your diet. Do take green leafy vegetables and all the foods with fibers. If you can manage your nutrition in a balanced diet, liver does not demand much. Again, it's a organ which is happy on its own. If you don't harm it will be okay. So just take your normal food, do good exercise, and forget about the liver. And of course, which should not be taken, of course, alcohol is a big issue. And again, I'm a person who is coming from the dry state, and still I'm talking about the alcohol. In fact, we get more patient of alcoholic hepatitis than alcoholic related chronic liver disease or alcoholic CLDs, because due to restriction, whenever people get alcohol, they go crazy. And there is another how much alcohol to be taken, that I would only say that no amount of alcohol is safe, because the alcohol, at what level alcohol will cause damage, that depends on your genetic structure, and you cannot define each person's genetic structure, and there is no long-term benefit of the alcohol. I am a big Bollywood buff, and I don't remember the film, but there is a dialogue that शॉर्ट टर्म गेन के लिए लंबे समय का नुकसान नहीं लेना चाहिए. So occasionally 6 months a time you are going to the party, it's okay, but otherwise avoid alcohol, avoid too much of fatty food. High cholesterol is of course it's dangerous to the liver. So all the talks regarding the heart health applies to liver also. Balanced diet is the key.
वेरी ट्रू, वेरी ट्रू. डॉक्टर साक्षी, आप क्या बताएंगे? क्या
Okay,
खाना
so
चाहिए, क्या नहीं खाना चाहिए?
okay, so for kids, as actually most of this has already been discussed by Dr. Sarini beautifully. It's just that we are repeating the things. So avoid too much of sugars, carbonated drinks, sugary, ye jo canned juices, too much of fructose, and all bad cholesterol, as already told. So anything which comes in packets, so that has all saturated fats, that is going to cause harm. Anything which is coming from trees is good. So anything which is natural, whether it is sabji and fruits, you can have as much as you want with good amount, or definitely saturated. जो पहले जो वनस्पति घी आता था, that is definitely dangerous for the body. But nowadays there are fats, but I'll not say everybody should have it. Those who can afford, olive oil is very good. Otherwise, have plant-based oils only. Avoid animals wala saturated fat. So this is what is very important. So in crux, anything in packets should be avoided. So all saturated fats, less of sugar, more activity. That is one for kids. Screen time now, because this is online classes and kids are sitting in front of laptops for last 3 years, and once they are free from laptop, because parents are scared to send them outside, after that they shift to TV, and once they are done from TV, then they are on mobile and video games. This should totally stop. I keep telling my patient, your child has to get up and go out, do cycling. If you don't want your child to intermingle with other people, at least he can do cycling. So some activity is very much required. Screen time should be restricted to less than 2 hours in a day, not more than that. Activity, diet, that's what, exercise. This is what is lifestyle modification, which is the first step, which is the most important thing.
Thank you, ma'am. I think these are all very important advice that we've just heard from both of you. How I say that to my patients is try to avoid whites.
Mhm.
एक तो मैदा, because that is pure carbohydrate and it causes peaks in the glucose levels that you've been talking and Dr. Sareen said. मैदे का कम से कम इस्तेमाल करें. Whatever is made of maida is going to increase your cholesterol levels. Yes. So because that would basically be processed food or some fast food. And the other thing is obviously sugar, because sugar is pure carbohydrate. And the third thing which I always advise is salt, because majority of the diseases which we are seeing today, the non-communicable diseases are related to both of these, either diabetes, obesity, hypertension, and the resulting heart disease. So these three things, if you decrease in your diet, are going to be very helpful. And then just as madam said, whatever grows on tree, so make your diet colorful. रंग बिरंगे फल, सब्जियां, पत्तियां, जितना खा सकते हैं unprocessed, कच्ची चीजें उतनी खानी चाहिए. And I think just as Dr. Bhavina said that whatever is good for a normal person to prevent heart disease, to prevent diabetes, to lower cholesterol is good for the liver. Because as now we are understanding that liver probably is the root cause of majority of these problems that we are facing today, including diabetes, obesity, heart disease. So I am so thankful to both of you and to Professor Sareen that you took out time today. You joined us and you've enlightened our audience, and they have really appreciated it, because we are getting comments in the chat box, we are getting feedback that this has been a very interesting session and people have learned from it. Once again, I would like to thank you on behalf of ASSOCHAM, on behalf of the CSR Council of ASSOCHAM, Mr. Anil Rajput. Unfortunately, he couldn't join us today. And I'm very thankful to the team ASSOCHAM who has worked so hard in organizing this webinar. And I'm very thankful to all our viewers and all our listeners and for all your feedback. So thank you once again and hope to see you soon again on such an interesting platform. Namaskar and Jai Hind.
Thank you very much.
Thank you.
Thank you.